And the suspects charged include nurses, home health aides, and even a pharmacist.
America, the Department of Justice just dropped the hammer on the largest healthcare fraud bust in the department history. Over 320 people are facing charges in what they're calling Operation Gold Rush, a massive investigation that uncovered nearly $15 billion in false claims and resulted in the seizure of $245 million in cash, luxury cars, crypto, and other assets. But here's what's going to tick you off. This includes a Russian crime organization operating right out of Connecticut that was stealing Medicare money using American patients' personal information, plus nearly 100 licensed medical professionals, including 25 doctors who were running pill mills and selling prescriptions for cash.
The DOJ is charging hundreds of people in what it's calling the largest healthcare fraud bust in department history.
So the investigation is called Operation Gold Rush and uncovered nearly $15 billion in false claims.
What is up, guys? Tyson Dela Cruz here. Thank you so much for rocking with me. This story has everything: foreign criminals stealing from Medicare, corrupt doctors fueling the opioid crisis, and a $10 billion urinary catheter scheme that shows how organized crime rings are systematically looting American healthcare programs while you pay higher premiums and deductibles. Let me break down the staggering scope of Operation Gold Rush. The DOJ charged over 320 people, including suspects from Russia, Eastern Europe, Pakistan, and other countries. We're talking about $15 billion in false claims. That's billions with a B. And they've already seized $245 million in cash, luxury cars, cryptocurrency, and other assets. One of the largest cases involved a $10 billion, get this, urinary catheter scheme that exposed how organized crime rings specifically target U.S. healthcare programs. Think about that: $10 billion stolen through fake medical device billing while Americans struggle to afford basic health care.
One of the largest cases involved is a $10 billion urinary catheter scheme.
The DOJ didn't slice up any words about who these criminals are targeting. These criminals didn't steal someone else's money. They stole from you. Every fraudulent claim, every fake billing, every kickback scheme represents money taken directly from the pockets of American taxpayers who fund these essential programs through their hard work and sacrifice. Nearly 100 licensed professionals were charged, including 25 doctors. These aren't street criminals. These are people with medical licenses who took an oath to do no harm, but instead chose to harm American patients and taxpayers for profit. Speaking of healthcare professionals who are supposed to help you, but instead exploit you for profit, that's exactly what's happening to seniors every day with Medicare. Just like these corrupt doctors and nurses were running scams while wearing white coats, Medicare salespeople are running scams while pretending to help you navigate healthcare. Look, these Russian criminals figured out how to exploit Medicare by buying legitimate companies, then using their access to steal from the system. Medicare insurance companies do the same thing. They use their legitimate licenses to access seniors, then exploit that trust to sell overpriced plans with hidden limitations. That's why Chapter is so crucial. While these healthcare fraudsters were stealing $15 billion from Medicare, predatory insurance companies are stealing billions more from seniors through legal scams, overpriced plans, hidden fees, and coverage gaps that they don't tell you about. Chapter's licensed advisors are like having your own personal fraud investigator for Medicare decisions. They know all the tricks these companies use to exploit seniors, and they're not getting paid commission to push expensive plans that you don't need. Here's the difference. These healthcare criminals stole money through fake billing. Medicare predators steal money through real billing with fake value. But Chapter's experts actually protect your money while getting you real coverage. Chapter's advisors don't work for insurance companies. They work for you. No hidden agendas, no commission schemes, just honest guidance that saves you money while protecting your health. If you're 65 or approaching Medicare eligibility, don't let Medicare predators run their scams on you. Get somebody who knows how to spot healthcare fraud before it happens. Check out Chapter at askchapter.org/Tyson or call 270-467-0614. When healthcare criminals are everywhere, you need somebody who's actually fighting for you. Here's where the story gets absolutely wild. A Russian criminal organization was operating right out of Connecticut, orchestrating a multi-billion-dollar scheme targeting and exploiting the Medicare program using Connecticut patients' personal information.
According to the feds, this Russian crime group orchestrated a multi-billion-dollar scheme targeting, exploiting, and stealing from the Medicare program using Connecticut patients' personal information to do it.
The operation was run by Kevin Valdanz, a Czech citizen and a member of a transnational criminal organization who purchased 3 companies, including medical home care. This crime group bought dozens of companies from legitimate owners that already had the ability to submit claims to Medicare. Here's how the scam worked. Once they purchased these companies, they had access to patient and billing information. Then they made fraudulent claims to Medicare for medical equipment, receiving millions of dollars while misappropriating the identities of thousands of Americans, including elderly and disabled patients.
The feds allege since the group purchased the company, it had access to patient and billing info, then made fraudulent claims to Medicare for medical equipment.
The Russian group was also transferring money overseas to China and Malaysia, showing this was an international money laundering operation. Law enforcement seized $17 million from this operation, but there's no mention of charges against Kevin Valdanz because he fled the country. But the Russian crime scheme wasn't the only shocking case. Michelle Mizuki, a nurse practitioner from Chizir, was charged for selling Xanax and Adderall prescriptions for cash out of an office in Wallingford. She was allegedly prescribing patients with large quantities and dangerous combinations without legitimate medical need. Here's the most horrifying and heartbreaking part. Investigators are aware of at least 5 overdose deaths in Connecticut within the last 3 years, where Mizuki prescribed a combination of Xanax and Adderall within 30 days of the fatality. This woman was literally killing people for profit. When reporters tried to get a comment from Mizuki's home, a man answered the door and said no comment when asked about the federal charges. She recently bonded out, which means this alleged killer is back on the streets while families mourn their loved ones.
The Justice Department added investigators are aware of at least 5 overdose deaths in Connecticut within the last 3 years in which Mizuki prescribed a combination of Xanax and Adderall within 30 days of the fatality.
This is what the opioid crisis looks like close up. Medical professionals who are supposed to heal people instead of dealing drugs for cash while patients die from deadly combinations that they prescribe. The fraud wasn't limited to the East Coast. In Indiana, a dozen medical workers face charges, including nurses, home health care aides, and others. 5 of them are accused of committing crimes in central Indiana, most working in hospitals or nursing homes.
Indiana Attorney General Todd Rokita also announcing state charges against a dozen Indiana healthcare workers, 5 of them accused of committing crimes here in central Indiana.
Most of them are charged with obtaining controlled substances by fraud, as well as failure to make, keep, and furnish records, both level 6 felonies. According to the charging documents, these healthcare workers took drugs like oxycodone, hydrocodone, and diazepam from hospital pill dispensers, claiming they were for patients, but instead taking them for themselves. One of the most shocking cases involved a pharmacist from Nobleville who was part of a pill mill operation in Houston, Texas. According to the federal indictment, she purchased 500,000 pills of oxycodone and hydrocodone, then sold them to drug dealers at a street value of $8 million.
One of the people federally indicted is a pharmacist from Noblesville, who the feds say was part of a pill mill operating in Houston, Texas. According to the indictment, she, along with others, purchased 500,000 pills of oxycodone and hydrocodone and then sold them to drug dealers.
A former FBI agent explained that the increased regulations around opioids have made this type of fraud very difficult to sustain. Can't be sustained for any length of time, at least not to scale, without somebody coming or knocking on the door. What we're seeing here is what prosecutors are calling a staggering breach of trust. These aren't random criminals. These are licensed medical professionals, pharmacists, nurses, and healthcare workers who took oaths to help people, but instead chose to exploit them and harm them for profit. The DOJ emphasized that they dismantle networks of corrupt pharmacists that exist solely to distribute drugs to addicts, dealers, and feed the addiction crisis that has devastated so many American communities. This isn't just fraud. This is fueling the addiction crisis that's killing a lot of Americans.
We dismantled networks of corrupt pharmacies that existed solely to distribute drugs to addicts and dealers.
The international scope of this operation shows how foreign criminals are specifically targeting American healthcare programs. From Russian crime organizations in Connecticut to Pakistan nationals involved in other schemes, this is organized international theft of American taxpayer money. The $15 billion in false claims represents money that should have gone to legitimate medical care for Americans who actually need it. Instead, it went to luxury cars, cryptocurrency accounts, and overseas money laundering operations, while Americans face higher healthcare costs. The fact that this required a massive multi-agency operation called Operation Gold Rush shows the scale of the coordination needed to catch these sophisticated criminal networks. America, this healthcare fraud bust exposes a systematic attack on our medical system, both from foreign criminals and corrupt American medical professionals. $15 billion in false claims isn't just a number. That's the money stolen directly from American taxpayers who funded Medicare and other healthcare programs. The Russian crime organization operating out of Connecticut shows how foreign criminals are specifically targeting American healthcare programs, stealing patient identities and billing information to loot Medicare while transferring profits overseas to China and Malaysia. The corrupt doctors, nurses, pharmacists involved in these schemes represents a complete betrayal of the medical profession. When healthcare workers are running pill mills that kill patients and steal drugs from hospitals, they're not committing fraud, they're destroying lives and communities. The 320 plus people charged and the $245 million seized shows the Trump administration is serious about going after healthcare fraud. But this is probably just the tip of the iceberg. When one operation uncovers $15 billion in false claims, imagine how much more fraud is still out there. This is why your healthcare costs keep going up. Criminals are systematically looting the system while you pay higher premiums, deductibles, and co-pays to cover the losses from the theft. I'll track these healthcare fraud prosecutions as they move forward. And remember, every dollar stolen through healthcare fraud is a dollar that should have gone to legitimate medical care for an American who actually needs it. Let me know what you guys think about this. Drop it down in the comment section down below. Smash the like button if you kindly would. Share, subscribe, and as always, guys, I'll catch you on the next one.